Today is Wednesday, March 17th, and this is our 24th iGeriCare live event. The topic today is about the Canadian long-term care strategy in COVID. As everybody knows, and in the one-year anniversary of the pandemic, Canada's really been struggling with respect to meeting the needs of its aging population. And the pandemic has been a profound shock to a lot of areas of the healthcare system, but probably no more so than the impact on older adults and older adults in what we sometimes refer to as congregate care settings, whether we call them long-term care homes or nursing homes. But that population has had profound impacts of the pandemic, both in terms of direct and indirect costs on the people and family members. So we're really pleased today and delighted to have a special guest, Dr. Roger Wong, to talk to us about some of these issues today. Dr. Wong is a clinical professor in the Division of Geriatric Medicine, the 13th president of the Canadian Geriatric Society. He has been tirelessly working to advance academic and clinical health science topics related to geriatrics. His work has really had a profound impact on older adults around the country and actually internationally as well. He founded the state-of-the-art acute care for elders unit, or ACE unit, in Vancouver, which has been implemented and modeled really nationally and internationally. His clinical research focuses on hospital medicine in vulnerable older adults, including quality improvement in acute care geriatrics. And he's published and lectured extensively on geriatric medicine and medical education. Really, we're just so delighted to have you today, Dr. Wong. And I should also congratulate you. Dr. Wong has been appointed to the Order of Canada, the first time a geriatrician has ever been appointed to the country's highest civilian honor for his contributions in the field of geriatric medicine, including the advancement of policies, education, and specialized culturally sensitive healthcare. So I thank you and welcome.
Thank you so much, Anthony. It's my great pleasure to be joining you, and good afternoon, everybody. Today, I'm actually speaking to you from the traditional, ancestral, and unceded territory of the Musqueam Nation. And it always means a lot to me to be reaching out to our communities across Canada, wherever you are joining us. And I also want to acknowledge the traditional caretakers of all the lands that you're coming in from. Gives me great pleasure to be sharing with you today. This past week has been a very special time for all of us in Canada and around the world, because it marks the 1-year anniversary of the World Health Organization declaration of COVID-19 as a global pandemic. We all have learned that COVID-19 has affected all of us, all of our lives, our routines, the things that we get to do, the things that we no longer get to do or doing differently, have taken a tremendous change over the past year. And as a geriatric specialist, I have to say that working tirelessly to advocate for older adults, their families, their care partners, and the loved ones has been something that many of us around Canada and around the world have been doing in the past 12 months.
We really thank you for all of your service, and I think it's a great opportunity maybe to talk a little bit about some of the work that you've been doing. Why don't we start nationally? Because I think that's been a really important focus since the beginning of the pandemic. I think you had really identified very early on that there was a crisis coming.
Yes, I actually remember that when the WHO has declared COVID-19 as a pandemic, and many countries, including in Canada, we started to figure out how do we best translate and transfer the scientific information that we need for everybody living in a community. And that includes older adults and their families and loved ones. And I remember from the very get-go last March, so March of 2020, one of the first things that we needed to help people understand is the importance about physical distancing. And somehow, what does that translate into for seniors and for their loved ones? I remember very early on, I was working with some of my colleagues here at UBC to try to figure out how to get a message out that physical distancing does not mean social isolation. Now, this actually happened way before any of the heartbreaking stories that we heard and we have seen, say, in long-term care homes and in many other settings. But at a time, trying to figure out, how do we protect seniors, so that they do not get the transmission of the virus, but making sure that there's not the unintended consequence of social isolation and loneliness. And so what we ended up doing from the very get-go, and I remember this vividly, the backstory is that just prior to a number of public health orders that were provided to us by the provincial health officers, we were able to, in a physically distanced way, record a number of short video clips to talk to seniors and their loved ones in multiple languages. We did it in English, we did it in Chinese, and then we translate into Punjabi. And trying to explain to people, what exactly do we mean? How do we protect seniors with physical distancing? And what do we do in order to make sure that they are still socially connected? So that bit of public service announcement was actually some of the very first pieces of knowledge, translation, and transfer that we did. And we didn't stop there. Obviously, at the national level, we subsequently have seen the very severe impact of COVID-19 on everybody, but in particular, older adults, in particular those who have long-standing health conditions, those who are more vulnerable, such as those who are living in long-term care homes. Very early on, I was very humbled to be invited by Dr. Mona Nima, the Chief Science Advisor for Canada, to be a member of the Task Force on Long-Term Care. Our job, working with colleagues across Canada, and there were about 12 or 13 of us, was to really try to make recommendations for the Prime Minister's consideration and for his cabinet consideration when it comes to what can we do to protect seniors in long-term care homes, but also to making sure that we factor in that very important component of compassion and care, because long-term care homes are the homes of many of these seniors. They're not, just some a setting whereby people happen to be there together. They are their homes. So we met tirelessly. I remember over weekends, we have to come up with recommendations. And then subsequently, we submitted our reports to the Government of Canada. And the reports are now available actually online. And I encourage the viewers to check them out. And they're very good web and PDF versions. But at the same time, I was also invited to speak to the Senate of Canada, specifically as an expert witness to the Standing Senate Committee on Social Affairs, Science and Technology, to specifically make comments, including about the improvements that we need to make in the long-term care sector in Canada. So I think it is very timely for us to have this conversation today as we mark the 1-year anniversary, because many of the things that I spoke about are still things that we need to actively work on now.
I'd be interested to get your take on the role of, the Canadian government versus provincial governments versus almost local organizations when it comes to long-term care. So maybe let's start with some definitions, because I gather there's not actually sort of one universally accepted definition even of long-term care and long-term care homes. But maybe you can talk a little bit about, what we are mostly talking about when we do speak about long-term care homes, and what that relationship is like between the federal government and sort of the experience of people living in long-term care and their family members. How does that what are some of those connections, I guess, between policy at the federal level, provincial oversight over long-term care homes, which I gather differs quite a bit province to province. And then, how does that translate for the caregivers that might be listening at home in some ways?
Absolutely. I feel that we are navigating a lot of complexity, and that's always the situation in health. But in fact, it's not just in health, because one of the first things we have learned when we talk about long-term care and trying to make improvements in a strategic fashion is it has to involve a cross-sectoral approach. It's a collaborative cross-sectoral approach. It's not only about health. It's about labor. It's about law. It's about business. It's about education, and technology, clearly. So we'll come back and talk about this. I feel that at the various levels of government, all levels of government, the first thing that I feel strongly about is we really need to impress upon our leaders in government to making sure that we all set the right tone. And by that, what I mean is we need to emphasize the humanistic and compassionate approach when it comes to meeting the ongoing needs of older adults, in this case in long-term care homes, but it's not just long-term care, in the community overall. We talk about aging in place. Wherever seniors are, we need to support their needs in those places. What it means, though, when the rubber hits the road, is that every one of us, we must dedicate priority from the society level. And that means paying attention and really giving the right enablers, the resources that are necessary to making sure that long-term care homes are adequately and well supported. Now, I feel that the government of Canada at a federal level clearly is well positioned to be setting the benchmarking, that strategy, that nationwide strategy. And part of that does speak to, Anthony, what you are talking about is about the importance of definition, nomenclature, or data. I think without data, it is very difficult for us to guide policies, because I think, when as clinicians, as academics, as, experts in the field, we always talk about we need to go where the data is driving us, and somehow translating that data into policies, into education initiatives, into the pieces that society works with. Let me give you an example. COVID-19 has, from the early days, from the get-go, revealed the significant issues that were always present structurally in the long-term care sector. None of us actually believe that it was all because of the pandemic that magically these problems arose. Well, these problems have been around for some time. And the issue, both at multiple levels of government, whether it is the government of Canada, the provincial and territorial government, which, as we know, as per the Canada Health Act, are responsible for the administration of health. And then the local jurisdictional governments, whether it is the municipalities, the cities, the townships, and so on. I think we need all of them to really work in concert together towards that common goal. A reality is that Canada is very diverse. It is diverse in many different ways. If you look at the operational models, for example, of long-term care homes across the country from coast to coast, there's a very heterogeneous variety of these models. And that does add to the complexity that I started talking about. And when you have fragmentation of a continuum of care, it gets exaggerated as a result.
It was interesting. There was a recent article in the Canadian Medical Association Journal looking at differences in different provincial responses to COVID-19 in long-term care homes, and they were comparing British Columbia and Ontario. And I think what you said is very true. The organization is very different within provinces and between provinces. And it seems like some maybe have a model, like British Columbia is maybe a little bit more of a model where long-term care is managed a bit more like the healthcare system, possibly with a bit more attention to accreditation and quality standards. And some maybe have had possibly more privatization or, privately run facilities. Maybe they're more separate from the healthcare system historically. Do you see a role then in what you're saying about kind of a federal government or national, that there might be a role for quality standards that are perhaps federal in that way, that maybe provinces would have their own quality standards, but there might be a sort of national bar, and maybe even some kind of national collection of data that could inform, how many hours of care are people getting and how many people are employed full time and some of the issues that have arisen?
Yes, Anthony, the short answer is yes, but allow me to please elaborate a little bit. I remember there was a recent forum, and I have really tried to participate in a number of different fora and different channels, trying to get the information and knowledge out to the public to do this outreach, which is what we're doing today. And one of the common question I got asked is to try to compare provinces and territories, different jurisdictions. I guess the reality is we realize that Canada is a vast place, and there are lots of different practices and lots of different factors at play. And therefore, it may not be completely easy or even fair to compare one jurisdiction with another, because perceptions speak a lot. And again, it comes back to that data versus perceptions, and then the intersect of the two. One of the things that I have learned is that when it comes down to resources and benchmarking in these various different jurisdictions, I think it is safe for us to say that overall, when you look at the Canadian setting, the level of resources and the kind of oversight, that need to be looked into when it comes to providing the quality of services in the long-term care sector in Canada, I think the level, I can say, is not quite at the desirable level that we would like to see, which is now amplified by COVID-19. I feel strongly that we need to develop national strategies to making sure that there's adequate and sustainable resources. And by resources, let's start out with people. It's about the people, our workers who work in long-term care. How do we empower them to make sure that they have the right skill set and they can focus on working in a single site without crossing locations at a given time? This has been something that in British Columbia, the provincial health officer acted very early on in terms of trying to make sure that workers are maintained safe and therefore residents in long-term care homes are safe. But you could imagine this is not as simple as just telling people what they need to do. It's about having national guidelines to address things such as compensation inequity, sick leave policies that would allow staff who have symptoms to be able to stay home without the fear of them losing their job. We know that this has hit particularly hard on people who may be from visible minorities. The whole issue about racialized workers and how many of them, even before the pandemic, had to work multiple part-time jobs to make ends meet. And the COVID pandemic has really amplified and exaggerated that stress at a national level. Coming back to your original question, I do feel strongly that there should be national accreditation guidelines. These guidelines should be there not so much as a tick box exercise, but they should be meaningful in helping to refresh long-term care skills. They should be there to help people understand best practices, not only in infection prevention and control, which we have heard a lot about during COVID, but in terms of how do we support seniors who live in long-term care homes who, for example, when they develop COVID and related disease, they can have complications such as delirium, acute confusion. Yeah. It so happened today is World Delirium Day. So we are talking about internationally promoting, raising awareness on acute confusion or delirium. I also feel that in addition to guidelines, we actually need to do a lot more in training more. We need to train health professional staff in, not only in the doctor's specialties, geriatric medicine, geriatric psychiatry, care of the elderly, family medicine, palliative care, etc. But what about our workers who actually work on the front lines? And they include all our personal kind of support workers. They include all our nurses. They include everybody who work in the sector. We know that in order to mitigate these very difficult challenges, we need to have a national strategy, which is fully embraced by the provinces and territories and fully implemented at the jurisdictional or municipality levels.
From your experience, are there countries or other jurisdictions who seem to be doing right? And if you had to identify your, top three things, because there's a lot of challenges, maybe three is too few, but if you had to, sort of pick your top list of the most important things to try to address to improve long-term care in Canada, what would be on your wish list?
I clearly have a few places I can talk about, but let me just start out by saying that notwithstanding the challenges that I've just shared in the Canadian setting, when I talk to my colleagues internationally, and a lot of us have been talking over the past year, I have to say Canada is reasonably positioned in terms of at least having a framework for improvements to take place. At least we have. Now, we often talk about the Canada Health Act. Notably, long-term care is not included in the Canada Health Act. I would think that there are a lot of folks who would suggest that we should give, reconsideration of including long-term care sector within the Canada Health Act. And I think that probably warrants another 45 minutes of another podcast that we can talk about. But when I look internationally, I think places certainly in Europe come to mind when it comes to other kind of models. I think whether you're talking about the Netherlands, whether you're talking about Denmark, some models in, to be fair, I think everything has to be contextualized. So you cannot just plug and play. You cannot just export a system from country X and say, okay, in Canada, that's what we're going to do. It's not going to work. The other thing I want to put in there is whatever strategy that we are putting in place and whatever actions that we're taking, we must keep in mind the importance of providing that culturally sensitive lens, that culturally sensitive approach. Because I have to say, in my clinical work in the front line, working with many seniors who perhaps grew up outside of Canada, perhaps they speak minimal or no English, and they have their values, their attitudes, and their beliefs in health that have been formed for decades before now, and now the pandemic hit. And what you try to do to support all these seniors and their loved ones and their families is really to we must do so by applying the culturally sensitive lens, because otherwise we haven't done our job.
I wanted to, before we transition to taking some questions from our audience, I thought it might be a good opportunity actually to share the slide that you had shared earlier, just to talk about the importance of aging and aging, healthy aging. And maybe just before we start going to questions, because I think what you were saying about cultural sensitivity and cultural care kind of moves to a broader definition of healthy aging and aging in place, doesn't it?
Absolutely. And thank you for showing and sharing this slide. This is actually one of my slides that I've used in a recent presentation. But what I wanted to share with the audience is we started off today talking about the WHO declaring COVID-19 as a global pandemic. Well, as we all know, WHO have other kind of health initiatives, and they also declare 2020 to 2030 as the decade of healthy aging, which I think is really meaningful to all of us. I mean, all of us are aging. And what we are talking about in this case is that process of empowering people to live the way that they would like to live and to remain functionally able to do things that give them a reason to value. And I think that's so important. And it clearly applies to the long-term care sector as well. When we're talking about supporting seniors and their loved ones, their families and so on, within the long-term care home setting, we have to remember that, a lot of the principles that we talk about that are important for us when it comes to healthy aging, they also apply to seniors living in long-term care homes. You may say, but they already have a lot of long-standing health conditions. We have to remember, though, that notwithstanding the physical limitations and or the mental limitations, for example, in those who live with dementia or with Alzheimer's disease, there's still a lot that can be done to really supporting them. And that's what we're talking about.
Great. Thank you. I think that's so eloquently put. Let me head to some questions that are coming in now. So here's a comment and a question. Tragically, the way Canada is structured with provinces, territories, and Indigenous peoples having the right to manage and regulate long-term care makes it totally impossible to suggest an international or national standard of care would benefit. Would it be better if the federal government took back the requirements and regulations governing how long-term care is delivered and provided in Canada?
So my response to that is there is no single right or wrong answer. I think some of the principles that we need to think about is the issue of implementation. I think a phased approach is something. So I'm assuming that we actually are all in agreement that a national strategy on long-term care for Canada is important. That is my premise. And if you believe in that premise, then I think the implementation can be a phased approach. Given the impact of the pandemic, the devastating impact of COVID-19 on seniors living in long-term care homes, the immediate phase of implementation may very well be, a rescue mission. And for that, I can see why, for an increased role of the federal government in implementing that phase will make sense. Because we need to save lives and to improve things because we're in such big deficit that they need to be remedied quickly. And I think eventually that needs to transition into kind of a longer term implementation phase, which then, involving the provinces and the territories will be really important. Now, obviously, for each of the recommendations, and again, I'm speaking about a task force on long-term care recommendations that we've made to the government of Canada for the Prime Minister and his cabinet consideration. I'm happy to say that a number of the recommendations have already appeared on the mandate letter from the Prime Minister to the Federal Minister of Health. So we, as the members of the task force, we're very encouraged to see that. Now, that said, action is what is needed now. I think many of us have heard the comment that, for seniors care and for long-term care, in Canada, we are great in doing studies. We study a lot and we write reports and we recommend. All that is fine, but it's time for some action. So I really hope that a phased approach of implementation of the recommendations that are already there, they are made by the task force for Canada. So let's get to action.
I can also, as exciting as it is for all of us to imagine the gradual end of the pandemic, I can imagine a way in which action on some of these issues moves to the back burner again as the pandemic and the crisis, sort of fades rapidly from memory. But I'll try to be more optimistic for a bit. Here's another question that a participant submitted by email. My parents reside in a retirement home. Both have had their 2 doses of Pfizer vaccine in January and February, along with the other residents of the home. When should life within the residence return to normal, i.e. masks, dining experience, activities? When is it to be expected that our parents can come out again to visit in their family homes for a meal?
I think all of us need to remain hopeful, and we need to be realistic and pragmatic about our hope. And that is my opening statement to answer this very personal type of question. I think it hits all of us to a certain extent. One of the things that I've learned about COVID-19 is we are learning a lot of information as we speak in real time. Oftentimes, I describe the last year or so during the pandemic as if I was seeing my professional career in geriatric medicine unfolding and being compressed within 1 year. All of a sudden, all the things that we have trained for and we have to put out into practice right away. And this is what I share with all my students and my residents and my fellows, the trainees, that this is real-time geriatrics. That said, there's still a lot that we don't know. So I would say that it is critical that we try to protect everybody, but in particular seniors, in particular those who are the most vulnerable, such as those living in long-term care homes, protecting them with vaccination. So I know that this is a hot topic now, the vaccination rollout across Canada. I know that people are doing whatever they can at the best that they can be. We need to continue with this momentum. We cannot let it slow down. So it is important that we continue to vaccinate as many people, including those who are in long-term care homes and those who work in long-term care homes. So that is the first premise. That said, we have to realize that because of the supply chain issue of vaccine doses that are available, the whole question of, most of the vaccines that we are administering require 2 doses administration. And with a first dose administration and then probably a different timeline for the second dose, the booster dose to go in, we're still learning in real time the effect. Early data would suggest that it probably is okay with the level of protection with 1 dose, but we don't know how long it lasts. We are still trying to figure out how quickly can we get a second dose in and really building upon that immunity response. So that's the other thing is we don't know what we don't know. That said, it is up to the individual provincial health officers across the country, which depending on local epidemiology, local number of cases of positive COVID cases, number in hospitals, number in intensive care units, number who died, depending on the numbers, the local numbers will direct the provincial health officer directions in terms of the other measures, be it physical distancing, be it masking, be it, hand hygiene should always be there. Let's put it this way. So I think those measures in different jurisdictions, in different provinces and territories, they may last for different periods of time. Many of us believe that we may be moving into the so-called new norm. Now, I know that many of us have really experienced pandemic-related fatigue, the psychological impact of COVID-19, the fact that we want to go back to that normal routine, but remembering that normal may mean something a little bit different now compared to a year ago. And I think that's the reality check.
Yeah. The one thing that I think is interesting about this question as well, we haven't talked specifically about retirement homes versus long-term care homes. But one of my colleagues who's a family medicine who does a lot of work with care of older adults was saying that, many of his patients that live in retirement homes, some of the situations in those retirement homes, they're not considered care homes, even in the same way that there are long-term care homes. And in some cases, that's another congregate setting where actually greater health supports for older adult residents could be much improved to help them to age in place in those settings that maybe don't require as intensive nursing care. So.
Absolutely. And I think another really important factor that all of us must remember, and I want to share this with the audience, is the importance and the value of really supporting families and loved ones and care partners, whether it's in a long-term care home or retirement home setting. Because we know that, and we began this particular conversation by talking about the importance of staying socially connected. And I just now talked about the importance, the normalcy of a routine. One of the things that we all have to remember is that COVID-19 has really taken a toll on the mental health of many of our older adults, but also in all of us. And for many of us who are care partners, who are family caregivers, the amount of stress that we are going through is huge, not only for our own psychological well-being, but also in terms of provision of care. The fact that families are now staying home, working from homes. Many of them are still doing that. Therefore, in exactly the same setting with where seniors live, it could be intergenerational because children could be going to school in the same household. And so the stress that is added upon over and above what is normally already required for providing the best possible care for seniors, that level of stress must be dealt with. And we have to figure out ways of supporting those folks as well.
We have another question. Is it safe to take unvaccinated new residents into our long-term care homes?
I think there is an ideal answer and there's a practical answer. And the ideal answer is straightforward. The ideal answer is the preference is always to have whatsoever way that we can reassure that new residents going into long-term care homes do not carry the COVID-19 virus. And remember, we now believe that there can be asymptomatic transmission, meaning people can spread the virus without having any symptoms. And so the only way of knowing that is through testing. And then obviously vaccination provides an extra layer of protection. So that's the ideal answer. The practical answer currently is we know that, again, Canada is a vast place and the practices are very different. Not just from province to territory, but even within the same province. For example, if you look from city to city, township to township, very different. So I think, a bit of a tailored approach, but a principle-based approach that whatever we do, how can we assure that there is, as much as possible, no transmission of the virus through the new cases, the new residents going into long-term care homes? I think that's the important piece.
Another question that was submitted by email. As a caregiver for my husband who has frontotemporal dementia, I dread the thought of one day having to have him admitted to a long-term care home after all the recent revelations about the conditions in many of these homes. What are the key priorities in choosing a good place for a person with dementia?
So we know that older adults who live with dementia, such as Alzheimer's disease, or in this particular audience question, frontotemporal dementia, they are particularly vulnerable to developing a number of complications, including infectious diseases, including COVID-19. And if so, then there is a higher risk of dying. And so this question, I can totally understand the significance and the worry from the loved ones. When it comes to supporting seniors who live with dementia, including frontotemporal dementia, in selecting a long-term care home setting, I think the first thing that we must remember is that as families, we choose not only based on the medical practices or the nursing practices that are being offered, but also that holistic view of what is a good fit for the person. So in particular, we know that individuals living with frontotemporal dementia, they may have issues relating to their behavior, for example. And some of the behavior, in terms of the management of the behavior, it really requires a holistic approach. There's no single medication that you can give to really resolving that behavior. By behavior, for example, I'm talking about a wandering behavior, walking around, or sometimes what we call disinhibition behavior, things that we don't normally see in seniors without a condition, but they can be quite distressing for loved ones or for other residents who experience or who witness these behavior. And therefore, I think that I spoke about compassion from the very get-go of this. That compassionate approach, that philosophy of care, will be really important consideration that I would advise. There are some mechanistic things that you can look for. The mechanistic things will be communication with families, attend a care conference and check out what is the conversation like. And this day and age during COVID, it could be virtual. That's okay. How frequently are those conferences? The doctors and nurses and services that are provided, even though they are not the only concern, that should be clearly a question that is raised. I talk about culturally sensitive care. That's important because if, for example, there is a language barrier to start with, what is care like in order to bridge the gap as a result of that language barrier. I think these are all not very small issues. They're big issues. One example that I will perhaps share to give you a practical example is during the early years of my professional career, I was actually the volunteer consultant, free of charge, who helped develop a state-of-the-art, culturally sensitive long-term care home in the Chinatown area in Vancouver. And one of the aspects in terms of the services or the care that we provide is about dietary services. So very interestingly, and this particular example involves Asians and South Asians, so specifically people of Chinese descent. To many of our seniors who grew up in Asia, having hot soup with a meal is really important. And it brings on that emotional value of that familiarity of staying at home in family. So our initial recruitment phase of the kitchen staff, the chef, the dietary services, in addition to a dietitian, was to try to make sure that who can we recruit who will be able to prepare hot soup on a daily basis for these seniors so that they have the feeling of staying at home. Yeah. I think that is one example that I would use. And we see this in many of the other jurisdictions. We know that, for example, there are settings that are germane to our Jewish people, to our Black people, to our Italian people, and so on. And so I think it's really important that we put that culturally sensitive lens.
Yeah. We've got time for a couple more questions. I'm worried we might not be able to get to all of them, but this is more of a suggestion comment. For those of you visiting loved ones in long-term care homes or visiting them online, be sensitive and aware of their sense of isolation. And rather than say goodbye at the end of the session, say, talk to you soon, or, well, I have an appointment, I need to go, but I'll talk to you soon, or I'll let you have your lunch now, etc. So just a kind of strategy like that.
I fully agree. I think communication, we all have learned that communication is always important, but it's especially important in times of a pandemic. And more so when you're talking about seniors who really are longing to that visit with families and loved ones. And I know that across the country, everybody is doing as much as we can to really help advocate for families to see how we can safely reintegrate them into the care aspect of those who live in long-term care homes. So critically important.
Here's a comment from a health provider, actually a question. As a health provider fully immunized, why do I still need weekly testing? I read that the Israeli experience is that vaccinated subjects are not asymptomatic carriers of COVID. I work in Ontario. Any thoughts on that?
I think that is a $1 million question because we still don't have all the data that we need to have a final ruling or saying on this. It is something that we are still learning. I think one of my prediction is in the coming months, as a population within Canada, a growing proportion gets vaccinated, I think some of the policies and the practices may evolve as we learn more from the data from real time.
I would agree with you. It's just a little too early right now, but the data is encouraging with respect to being fully vaccinated and transmission. My father has advanced Alzheimer's. His eyes can't focus on tablet for a virtual visit. Social visit with 6 feet of distance is still challenging to get his attention. Face-to-face and human touch would work best for him. I've seen a senior's home in a European country use a clear plastic curtain in a room to create the shield, yet allow the family and resident to touch. Do you think Canada could adopt the same or similar creative idea for advanced dementia in long-term care? Thank you for your input.
Well, I thank this audience for sharing that very important question because, as I mentioned before, social connectivity is crucial for all of us, but in particular for seniors, in particular for those who live with dementia, such as Alzheimer's disease. I think the example that is provided is one of many different examples of trying to, on one hand, have some kind of a physical protection against the transmission of the virus, but still staying socially connected. A quick word about technology in the virtual platform. While the virtual platform can be helpful, we have learned from the get-go that it cannot be the standalone, the only intervention. It has to be used in combination with a lot of other things.
Yeah. I'll try and squeeze in one last comment. This is a person whose father lives with advanced Alzheimer's, who's lost his ability to speak. He lives in long-term care, and he does express himself sometimes through laughing, shouting, crying. He has had periods where that have been labeled by staff as aggressive when he's nervous, when being put on a ceiling lift, and he would start to shout. And staff claimed they were unable to perform the duties. They requested the doctor to give him mirtazapine and duloxetine. These are two antidepressant medications. And we're worried by calming his brain too much, it might make his dementia deteriorate even more. As family members, do we have a choice? What are our alternatives? Should long-term care staff receive more training in how to handle residents with Alzheimer's disease and dementia?
Well, again, thank you for this audience for sharing a very personal story. Obviously, it's very distressing for us, even listening to the story. What I can say are really three things. Number one, behavioral issues, what we call behavioral and psychological symptoms of dementia. But behavioral issues are quite common in seniors who live with dementia, Alzheimer's disease, in particular those who are with more severe disease, more advanced disease. So this is common. And that said, the solution typically does not rest with a single pill or medication. It rests with behavioral management, non-medicine ways of managing. And that involves a lot of different things. And that itself is probably another podcast in itself. The second point I would share is education is crucial. So education of workers, the staff who work in the care home, but also education of family members, because all of us can do our bit in terms of supporting seniors who have those issues. Not easy, I would say not easy, but it can be done. And the third piece of advice is for situations like these are very complex situations. Oftentimes consultation with a geriatric psychiatrist or geriatric medicine specialist can be helpful. So this might be something that is worth talking to your doctor about and requesting a consultation.
I would agree. And even a family meeting with staff to express those concerns.
Absolutely.
Wow. This has been an absolute wonderful privilege. I want to thank you so much, Dr. Wong, for being our guest expert today. iGeriCare was developed with support from the Canadian Centre for Aging and Brain Health Innovation, powered by Baycrest. We're fortunate to have had support from the Jerris Centre at Hamilton Health Sciences, McMaster University, the Hamilton Health Sciences Foundation, the Alzheimer's Society Foundation of Hamilton Halton, and our team at the Division of E-Learning Innovation. Once again, I encourage people to help to support iGeriCare and to bring in great guests like Dr. Wong. There's a donate button at the top of the site. Our next live event will be scheduled for the end of April, Thursday, April 29th at 1 o'clock. The survey for your feedback is pinned at the top of the comments section. So as always, we look forward to your feedback and any suggestions for future live events. And just a thanks again to the Division of E-Learning team. As always, teamwork makes the dream work. So thank you again, Dr. Wong, and thanks everybody. We'll see you next month.
Thank you very much.